Respected chairpersons and learned audience, it's a 4-year-old longitudinal study of about 45,000 individuals to see the reduction in blindness and visual impairment. This is a study we have done in a low-income area in Pune. We set up a vision center to serve the population and we re-examined the entire community after 4 years. This was based on L.V. Prasada Institute model, and Dr. T.P. Das had given us his technical guidance and blessings, and Operation Eyesight Universal had done it. Vision centers form the base of the pyramid, but there has been no study which actually showed the impact that a vision center has made in the community. So we've tried to do it in Pune because we know vision is very, very important. Here we have these 4 healthcare workers or ladies between the age group who have studied till 5th to 10th standard. They have gone and examined people's vision in their homes. Those who had vision less than 6/18, they were referred to the vision center. Those who did not come to the vision center, the optometrist has gone to their homes, and the optometrist has gone with a autoref, a handheld slit lamp, a rebound tonometer, and has done the home visit. And anybody who has not improved to 612 has been seen by an ophthalmologist, and Dr. Supriya Fadke, she assigned a cause of blindness to those whose vision did not improve beyond 660. And these are the results. So 4 lady healthcare workers, 1 lady ophthalmologist, 1 lady MSW, and it was heartening to see that 60% of the OPD, 58% of cataract surgery, 58% of specs prescribed, and even 57% of specs sold have been sold to women in this vision center in a 4-year period. This is the age and gender distribution of the 2 cohorts. The difference that you see between the 2 figures, 44,535 and 43,708, is because in that 4 years, 222 had died, 396 had moved, 28 refused repeat examination, only 181 were lost to follow-up. And this is the visual acuity of the individuals examined in 2015. 0.26% is the prevalence of blindness, which is quite less, but then it is for all age groups. But here in women, it is 0.3%, that is 1.5 times the blindness in men. And this is in a place like Pune, which is supposed to be, relatively very gender neutral and relatively, you can say, socially developed. And of course, in the age group of more than 70, 5% blindness, in more than 80, almost 3% of blindness. Now, we didn't look only at the better eye, because in better eye, sometimes you miss out on the worse eyes. So when you look at the worse eye, the prevalence of blindness is 0.72%, which fell down to 0.44%, almost a half reduction that we were able to do in 4 years. But here again, those who are more than 70 years of age, almost 10% of them have one eye that is blind by WHO standards. Again, women had more blindness, and this is statistically significant. Older groups had more blindness, and head of the family, we believe he's the head of the family, he's the earning member, but they are more likely to be blind because they are older. Again, when we set up the vision center, the impact is definitely there, but women still have a higher prevalence of blindness, and we need more studies to find out why that is so. The prevalence of blindness has reduced even though the average age of population has increased by 4 years. So that is good. And of course, more women visited the vision center. Again, in causes of blindness, first we offered them subsidized surgery at 3,000 rupees. If they couldn't afford, free surgery. But even with them, even after 4 years, 40% of blindness is because of cataract. So just doing good surgery, free surgery is not the answer. There are more psychological barriers that we have to understand. And of course, strength is that more women accessed, comprehensive, reliable service which pays for itself. And most importantly, unlike ICAMS, it gives person-based, individualized care to the community and allows for health education, health promotion, which is very important for myopia, for glaucoma, for diabetic retinopathy. They cannot be solved just like that. And all the other prevalence studies that we quote, all of them are based on stratified sampling. This is a small study in which the entire universe, the entire population has been studied. The RAB study population only 50 years plus. We have done it for all the age groups. That is the strength of our study. But then of course, it is time consuming, it is costly, and of course the vision has been measured in people's homes, so there will be an inter-observer variation. But then we know healthy eyes finally lead to a happier life, and primary eye care, as all the stalwarts in the room know, is the basis for delivering good secondary care, for delivering good tertiary care. And finally, there has to be a backward linkage for low vision rehabilitation. We have to go back to the community again, which is what the Vision Center approach helps. And this could not have been possible because we literally had so many people who volunteered, who paid, and who helped. And of course, our paying patients who kind of cross-subsidized this study, and Operation Eyesight Universal, who gave us their technical assistance. Thank you.